Dr. Matt here today. Today I want to talk to you guys about postural restoration, okay? Postural restoration plays a huge role in chronic pain today, and it also can play a huge role in lowering the pain throughout your body. So, symptoms that you're going to start to see as a result of poor posture, okay? And when I say poor posture, from the front, your nose should be right in the center of your sternum and go all the way down. Your shoulders should be nice and level. Your ears should be nice and level. Your hips should also be level. And from the side, your ears should be over top of your shoulder, which should be over top of your hip, which should be over top of your knees and your feet. So later in this video, I'm going to show you what that looks like on some patients or on some staff members so you can see where these postural imbalances begin to happen. And then I'm going to show on another video things that you can do to start to correct or stabilize some of those things, okay? But some of the symptoms that you're going to get are tension in your neck and head, neck and shoulders, okay? You could even get tension headaches for that matter. Poor posture at a computer, you'll find that your head goes forward, and by the end of the day, you just get this tight, knotty mess going on in your shoulders and into your neck, and maybe even feeling it down into your mid-back. This can cause rolling of the shoulders, okay? Your shoulders or hips and knees become to take more of the stress, so we start to get joint pain as well as pain in the back. Not uncommon to start seeing migraines and headaches, all a result of poor posture and imbalances within the spinal column as well as the nervous system. Chronic fatigue. So why does chronic fatigue pop up with bad posture? Well, you see, the body is always working to correct itself, okay? It's always working to correct it into a more or closer to normal position. So if you're biomechanically or your posture is off or has been off for years, okay, your body's going to try to adapt to that. And one of the things that is an adaptive change to the body is actually osteoarthritis. Osteoarthritis is an adaptive change to an abnormal response. It's actually your body doing the right thing by adapting to abnormal stresses around it to help support those joints in those areas. So when arthritis develops in the spine, it's a result of something else typically, and it's a result of biomechanical issues as a result of poor posture, muscle imbalances, and poor alignment. So the body actually lays down arthritis as a result of bad biomechanics. Breathing issues. So how does posture play a role in breathing issues? Well, if you're just sitting here watching this video right now, I want you just to look down and take a deep breath. Feel that pressure that's on your chest, okay? Now, sit up in a good normal position and take a deep breath. You can feel that the air in the lungs open up much, much easier when it comes to breathing. So getting the oxygen in our body and allowing the waste to get out of our body with good breathing plays a role in posture as well. So, neurological symptoms. When our posture begins to change, it doesn't just affect the bones, but there's a spinal cord that runs through it. And as our posture begins to change, it begins to put tension on the spinal cord. And this can create brain fog. It can create sometimes dizziness, sometimes blurred vision, all neurological symptoms that people could develop as a result of poor posture over time. Scoliosis is another one. This is the spine actually making adaptive changes to stresses on the spine over time. It can be very painful. Posture plays a role in athletic performance. So if you're a triathlete, if you're a high school athlete, a college athlete, making sure you have optimal posture plays a role on how injured you're going to get. It's going to play a role on pulling muscles. is going to play a role on your ability to recover. Remember that your body is just a system of a bunch of pulleys, essentially, with the muscles and the bones pulling in different directions. And so if one of those pulleys changes and the rope on the trying to move that bone, or that muscle trying to move that bone, has more stress on it, you're going to have a lower athletic performance as a result of poor posture degeneration that's building on those bones. Another one here that's affecting a lot of people, okay? In fact, we get a lot of referrals from dentists with this one, and this is TMJ. And TMJ begins to develop because of tight muscles through here in the upper jaw area, as well as in the neck, because the head begins to go forward and those muscles are stressed, creating tension on the TMJ and abnormal alignment within the jaw. So posture is very, very critical to long-term health, to reduce arthritis. Neurologically, it's very important for your body, and it's something that we really need to start taking more seriously, because osteoarthritis and degeneration is affecting almost all Americans today as we age. Now, I want to clarify this, because osteoarthritis is not an age-related disease, okay? It's a poor hygiene disease, just like cavities many times are not an age-related disease to the teeth. It's that we just are not taking care of our teeth properly. So check out some of our spinal hygiene and our joint hygiene videos for more information on how you can actually take care of your spine and take care of your joints, so that you don't end up like so many Americans today, and we can start to change the number of people that are suffering from arthritis and joint pain.